Welcome to the Explainer. Today, we are breaking down what is very likely the biggest, most important exam of your entire nursing career. We're talking about the Next Generation NCLEX-RN.
Okay, let's just dive right in. Look, we all know this exam can bring up a ton of anxiety, but my goal here is to take all that nervous energy and completely flip it into confidence by giving you a super clear, actionable roadmap for success.
Right, first things first. Let's just acknowledge what we're up against. The NCLEX you're getting ready for it's evolved. It's now called the Next Generation NCLEX, or NGN, and it really is a whole new level of testing. And this is absolutely the most crucial thing to understand. This isn't your classic memorization test anymore. The NGN is specifically built to see how you think, how you reason through a problem, and how you make those critical decisions in scenarios that feel just like the real world. We've moved way beyond just recalling facts. So, that leads to the big question, right? How do you even prepare for a test like that? Well, the answer really boils down to mastering one single core skill: clinical judgment.
And this definition right here, it's everything. This isn't just some textbook term. It's the absolute heart of what a nurse does. The exam is literally designed to evaluate your ability to take in information, think critically about it, and then make a decision that keeps your patient safe. It's about connecting the dots just like you're going to do every single day on the job.
And here it is. This is the exact framework you need to burn into your brain. The National Council of State Boards of Nursing actually created this 6-step model. It's the thought process they are looking for, from the moment you recognize important data all the way to checking if your actions actually worked. Seriously, every single question on the NGN is built around these 6 skills. So how does this all translate to the actual test? Well, the great news is the exam isn't just a random grab bag of questions. Nope, it follows a very specific, very predictable blueprint. And understanding that blueprint, that's your first major strategic advantage. This chart gives you that bird's eye view of the 4 main categories. But I want you to look at that biggest slice of the pie: physiological integrity. This one section can make up anywhere from 38 to a whopping 62% of your exam. The chart is basically screaming at you where to focus the bulk of your study time. And this table, it breaks it down even more. You can see the exact percentages for all 8 key areas. Look at management of care at 17 to 23%, or pharmacological therapies at 12 to 18%. This isn't just a bunch of numbers. This is your personal guide for how to spend your precious study hours most efficiently. Okay, so now you know what content is on the exam. But now let's get into how they're going to test you, because the format of the questions themselves, that has gone through a massive transformation. This right here is a huge shift, and honestly, it's fantastic news for you. The old exam was totally all or nothing. You were either 100% right or 100% wrong. The NGN, it uses partial credit scoring. This is a complete game changer because it means the exam can actually reward you for having the right idea, even if your answer isn't absolutely perfect. It's just a much better reflection of the real world. So to test your judgment, you're going to face a whole new set of interactive questions. Instead of just picking A, B, C, or D, you'll be doing things that actually mimic the job, like analyzing case studies that unfold over time, dragging and dropping information to show priorities, or even highlighting key text in a patient's chart. Each one is designed to see your thought process in action. And you have to hear this. This is so important. This isn't a maybe. This is a for sure. Every single person who sits for the NGN will get exactly 3 unfolding case studies. That's 18 total items on the exam. It's a guarantee. You simply cannot walk into that testing center without being completely prepared for this specific format. So, we've got the new focus on clinical judgment, we have the exam blueprint, and we have these new question types. How on earth do you tie all of that together into a strategy that's actually going to work? Well, it's all about using an integrated approach, something people call the pyramid to success. This makes sure you're not just studying content in a bubble. Instead, you're weaving together your content knowledge, your test-taking strategies, and a lot of dedicated practice with these new question formats. Think of this as your final map, the one that guides you through a really focused prep, which is, without a doubt, the key to conquering this exam. When you really break it all down, the path forward is actually pretty clear. By understanding the exam structure, mastering those 6 steps of clinical judgment, and just relentlessly practicing these new dynamic question types, you're building a foundation that will let you walk into that testing center not with anxiety, but with real confidence. The NGN isn't just a test to pass. It's the first day you truly start thinking like a nurse. So the real question is, are you ready to start building